Well, we're here today with Dr. Rubinstein, a dentist in Manhattan, in fact. Dr. Rubinstein, how are you?
I am fine.
Good. Dr. Rubinstein, tell me, you have a dental practice, and tell me about your dental practice, because here's what us patients sometimes feel. On one hand, every dentist is a dentist is a dentist. Every dentist is the same, kind of. You all go to the medical school, you graduate your license. At the same token, we patients have a distinct feeling that not every dentist is the same, and that doesn't mean one is a lot better than another one, but like fits us personally, a little bit like getting married. Lots of pretty girls, but there are some girls who just fit us then better, and hopefully we find the one who really fits us good. So describe your practice a little bit. Well, what are you doing in your practice? Which type of patients are coming to your practice? What can they expect in your practice?
Well, in my practice, they can expect probably an honest appraisal of where they are at the present time, and they can feel free to ask questions about what is available for them in my dental practice as far as treating their problems or treating their aesthetic needs or what technology we have towards doing certain procedures. And hopefully I explain to them what can be done, how it will be done, the time factors, cost, what options they have as to various treatments, and hopefully that they feel that that their wants and wishes will be paid attention to, and in the end they will be happy and healthy.
That's a wonderful thing, because sometimes we do feel that specialists in any area, be it a plumber or be it a doctor or a dentist or God only knows what, keeps telling us what we need. And while we do want the people's advice, we feel that we have our own wishes, and sometimes they're not followed. In fact, the medical field has a big problem of that. Doctor sees a patient for 4 minutes, and the patient wants to talk a half an hour about his illness, which is totally understandable. Now, tell me, do you see, because you're in practice for quite a while now, you haven't quite started practicing yesterday, and I don't say that because you look so old. I say that because one can see experience in your face. How long have you been in practice?
Well, I've been in practice for 41 years and heading to 42 years,
Beautiful.
so it's been
So
a long time.
So let me ask you, is your practice somewhat like a family practice? Are you actually sometimes at this point seeing the children, maybe even the grandchildren of people who have been children with you? Or don't you see children? Give us a little bit, old, young people. Do you see, is your practice a practice where I can come to you and I want like a Julia Robertson or a Tom Cruise smile? At the same token, is your practice a practice where I just want functional dentistry? I know that I could improve my smile a little bit, but it's not priority, maybe because of money and many other things. But at the same token, I want to make sure that I don't get more sick by having my mouth falling apart. Um, which type of patient fits in your practice, or are they both fitting into your practice?
Well, I have, it's sort of weird to think that I actually know certain patients for so long that they actually have children who have children. And so I do treat some families. New York is sort of, as many practices are in a city like this, very changing at times. People don't hang around as much as in suburbia for 30 or
Right,
40 years.
right.
I actually don't treat a lot of very young children. Most of them probably are probably from about age 8 at the earliest on up. I treat elderly, people who are in their 20s, 30s, 40s. So it's been a long practice. Some people are here and gone before you have a chance to, spit, but essentially everything seems to be, whoever's coming is going to be treated in the way that I feel would be best suited for what their needs are and what they
Right.
want to do.
Right, obviously Manhattan, being it a Koreatown and stuff, people come and go in a New York minute, as they say, right? Now, so a person comes in and wants dentures or implant dentures. A person wants implants. A person wants some orthodontic work. A person wants simply a few teeth pulled. A person wants veneers and lumineers. And a person wants periodontal, has periodontal disease. Are they? You can and serve them all. Yes or not?
Well, for most of the procedures that you just spoke about, I do treat them. There are certain things that I don't do. I basically do restorative dentistry, and so I restore implants. I don't place them. So I use a combination of treatments depending on what the patient's needs are, what I can accomplish and handle. I treat in the office, whether it's a root canal, some periodontal surgery, things that I think are a little bit more complicated for what I can handle. I certainly refer out certain oral surgery procedures of impacted wisdom teeth I'm not going to treat. As I said, implant placements I don't do. But most other things, from veneers to restoring implants to dentures to a simple filling to bleaching to whatever cosmetic needs and restorative needs, we do treat it.
Wonderful. Well, it makes lots of sense, of course, that, I mean, not for nothing, we do have some specialties. On one hand, people like to have a lot done under one roof, which you seem to be doing, but at the same time, you seem to be recognizing the fact that when somebody who does a particular thing all the time is better for the patient, a little bit like the Hippocratic Oath, where if you think that somebody else would suit the patient better, you better get him to that person. Well, Dr. Rubinstein, thank you very much for enlightening us about your practice. And we'll be talking more about some specific procedures and problems we find with patients. Thank you very much.
Thank you, and have a good day.